Hello and welcome to our next episode of Live and On Call. I am your host, Allie, and we are here today to talk to another specialist about a topic that we all are wondering about, and a topic that maybe you're not super excited to think about all the time. But I just wanted to let you all know if this is your first time joining us, here's what to expect. We will start with a discussion for today's topic, and then we will move into Q&A. So we're all here to learn. I know I will be here fielding your questions, but I will also ask a few of my own questions. So don't be afraid. As we discuss the topic, you can drop your questions in the comment section below. So as we wait for people to join, I'm going to go ahead and introduce today's topic. Each year, thousands of Americans are diagnosed with colon cancer, and sadly, it will take the lives of about 50,000 people this year. Over the years, experts have actually seen an increase in early onset colorectal cancer. So as a result of that, the American Cancer Society has lowered the age of screening. It was recommended to get colonoscopies starting at the age of 50, and now it's recommended to be done at the age of 45. This is the best tool to prevent colon cancer, but don't take my word for it. I will let you talk to the specialist in this area. Dr. Frank Marrero, board-certified gastroenterologist with the Memorial Medical Group, will join us today. Dr. Marrero, how are you doing today?
I'm doing super. How are you doing, Allison?
Great. Thanks so much for joining us. I hope that you are ready to answer all of the fun questions today.
Absolutely. And thank you for the introduction. And just to reintroduce myself, I'm Frank Marrero. I've been a gastroenterologist for about 12 years or so. I've been at Lake Charles Memorial Hospital as part of the Memorial Medical Group for about 11 years. And it's been great being here in Lake Charles and taking care of our population, and look forward to doing that for many years to come. And I appreciate you having me on this Facebook Live encounter, because March, if you don't know, I'm going to tell you, is Colon Cancer Awareness Month. So we're trying to get the word out to get people screened. This is an extremely important topic. Colon cancer is an important cancer to take into consideration, as it's one of the most common types of cancer that occur in persons, and it's also one of the most deadly cancers. And the sad thing about it is that it's completely preventable under most circumstances, and people that unfortunately get colon cancer probably could have prevented it by taking some measures early on. And that's really what we want to stress, is preventive care and preventing the cancer rather than having to deal with it before it occurs.
Great. So why don't we just take a step back real quick, and I want to hear a little bit more about you, Dr. Marrero, and tell me about the patients that you see come through your doors. What brings them to you in the first place?
Sure. So we see patients with all kinds of gastrointestinal conditions, including heartburn, reflux, difficulty swallowing, abdominal pain, nausea, vomiting, diarrhea, constipation, irritable bowel syndrome. We treat basically any disease of the intestines, including Crohn's and ulcerative colitis, pancreas disease, and liver disease as well.
Great. So part of that, in addition to all of those things that you just mentioned, part of that is doing and administering the colonoscopy procedure, right?
Absolutely. So one thing about gastroenterologists is we are specifically trained in doing endoscopy, which is a procedure where we place a camera into your intestine and physically take a look. And we can either do that down the throat into the stomach and esophagus, or through the rectum into the colon.
Gotcha. And so that is one way to screen for colon cancer. And is that our only option?
That would be arguably the best option for most people. There are other options for colon cancer screening, including fecal tests and imaging as well, like certain types of x-rays or CAT scans can do it as well. The one thing to keep in mind of all the different methods for screening, whether it be a stool-based test or some sort of x-ray imaging, those tests really only pick up a problem after it's occurred. And that's what separates colonoscopy and makes it arguably the better test. Is not only can we detect a cancer, we can also prevent one from developing colon cancer by finding polyps in the colon, which are small tissue growths that over time can grow bigger and bigger and become a cancer. And colonoscopy has the added advantage of being able to find those at much smaller sizes, remove them, and thus prevent a cancer.
So just to clarify, the abnormalities can be seen on imaging, but it's better to get a colonoscopy just because it's a little bit more thorough.
It's a lot bit more thorough. It's actually a physical look inside the colon with a camera, as opposed to looking at shadows or image interpretation. The imaging studies don't pick up smaller polyps. They only pick them up once they're a decent size and or once they've already become a cancer, and that is sometimes too late. And that's why colonoscopy has an advantage of being able to pick things up much smaller and remove them on the spot in one test rather than having to do multiple things. For example, if you had one test you can do for colon cancer screening would be something called a barium enema. If that finds an abnormality in the colon, you get re-referred to have a colonoscopy to begin with. So it gives an advantage to do the colonoscopy because you can just do one test rather than doing multiple tests.
Gotcha. And so I talked about earlier the screening age, but what are maybe some other reasons that someone would need a colonoscopy?
So for certain, if there are concerning symptoms, one important symptom that we look at, especially in risk for colon cancer, would be rectal bleeding. A lot of times people just kind of blow off rectal bleeding and think that, oh, well, it's just hemorrhoids or something like that. And while that may be the case and frequently is the case, there are instances where we found tumors in the colon that were misinterpreted as hemorrhoids, and thankfully we were able to get them in and get a look and confirm that it was another problem. Other issues that would require or we would suggest taking a look with a scope would be a major change in a bowel pattern. And for example, if someone's very regular, they have a bowel movement every day or two, and then all of a sudden they're going 5, 6, 7 days between bowel movements, or having diarrhea or more frequent bowel movements, that may be an indicator that there's a problem going on in the colon that would require investigation. There are a myriad of other reasons, but mainly just for any concerning symptom that somebody would develop, like pain, bleeding, alteration in the bowel habit, unexplained weight loss, things like that.
Gotcha. And just a reminder for those of you who are viewing and who are listening in, if you have questions, go ahead and put them in the comment section below, and we'll get to them in just a little bit. This is what this is all about. Is Dr. Marrero is live and on call for you today. So don't be afraid to post those comments in the comment section below. Just moving on down my list of questions. Over the years, there's been an uptick in early onset colon cancer. And how do you define early onset, and why do you think that may be the case?
That's a good question. And you had mentioned in the intro that the age to begin screening has changed from 50 down to 45, and a lot of people aren't aware of that. And this has been a recent change. The American Cancer Society, I believe in 2018, had started out making that recommendation. And then a larger governing body of making recommendations called the U.S. Preventive Service Task Force in 2021 made that recommendation. And now it's universally accepted, and most insurance companies and Medicare is allowing, which most people at 45 don't have Medicare, but most insurance companies are allowing screening to start at an earlier age. Years before, we started seeing an uptake in colon cancers and polyps at the age of 50. And so that's the main reason why 50 was the chosen age to start screening. However, we've done a really good job with that. And actually, we've seen reduced incidence of colon cancers and reduced deaths from colon cancer in older age groups. But what has happened in the last 10, 15 years, as we've seen an increase in the number of younger patients, meaning 40 to 45, getting polyps and advanced polyps and then cancers. So they backed off on the screening age to 45 to try to capture more of those patients. And ideally, we'd even start younger, but you have to pick some place that makes economic sense as well, because you can't just start screening everybody at the age of 20. That would just be unreasonable. But 45 is a good place to start. And there are some caveats to that. If there's a significant risk, an average risk patient would be somebody who's just 45. They don't have any major symptoms. They don't have a significant family history of colon cancer. And that would be the person we'd want to start at 45. But if you have a family history of colon cancer, specifically what we call a first degree relative, mother, father, brother, sister that developed a colon cancer, we recommend you start screening even sooner than 45. And typically that would be starting at the age of 40. However, it could be even earlier depending on when that relative developed a colon cancer, and that's something you'd want to discuss with your doctor. But in general, we'd want to start screening about 10 years before your first degree relative developed cancer. So for example, if your father developed colon cancer at the age of 35, we would want to start you at 25.
And so in a situation like that, I mean, I know it varies depending on your insurance coverage, but is that typically accepted by insurance companies for that screening?
It is typically accepted. And of course, you always want to run it by your insurance company to make sure it's covered so that you don't get surprised with a bill. Some insurance companies may consider that a diagnostic versus a screening exam. And that's what you need to clarify with your insurance company before you have a procedure. And the difference between that is a wellness exam, under the Affordable Care Act should be covered 100% with your insurance, whereas a diagnostic test would be considered to be a test that where if you have a copay or a deductible, that would take effect. So there could be a significant, financial implication depending on how your insurance company judges the procedure to be. The other thing, however, is if there's a symptom we're looking for, say you come in with a complaint of bleeding or an alteration in your bowel pattern, as we discussed earlier, that would almost always be considered a diagnostic test. So you'd have to be prepared for, to utilize whatever your copay or cost sharing is with your insurance on that.
Gotcha. And so besides the screenings and staying up to date on those and making sure that we're visiting our primary care doctor regularly, what are some other things that we can do to prevent colon cancer? Is diet or lifestyle part of that prevention?
It is to a degree. Of course, the best way to prevent colon cancer is having polyps removed. But you can do yourself a favor as well by eating a really good, healthy, high fiber diet, which is a universal recommendation for most people. And there have been some studies that show that aspirin use and other things may reduce risks of polyps, but the evidence on that is not robust enough to make a generalized recommendation. So from an official standpoint, there really is no other significant modification that one could make to really reduce their risk for developing colon cancer other than undergoing screening and surveillance.
Right. Well, that's good to know, because that means that at some point it becomes out of our control, and that the only thing we can control is keeping a handle on that, kicking our rear into gear and going to get those colonoscopies.
Yes.
So I have one more question for you before we get to the Q&A in the comment section. So you guys, if you that are listening, if you have something that you're thinking about and you haven't put it in the comments, go ahead and do that. But I had one more question. What is your advice to those who are listening? Just what is one takeaway that you want to give them that are listening to prevent colon cancer?
So one of the big impediments I see that prevent people from coming in is I guess it's kind of urban legend, or maybe people's experience from years past about discomfort or embarrassment or or safety of colonoscopy. And I believe that really prevents a lot of people from coming in and getting screened. They think that the bowel prep to clean themselves out before a colonoscopy is just going to be miserable, and they don't want to do it, or they feel that it's going to be painful, or that they're going to experience some sort of horrendous complication like a bowel perforation or something. Now, colonoscopy is an extremely safe test. First of all, now, of course, it's not impossible to have a complication from it, but it's very rare in expert hands. And again, in expert hands, I would recommend seeing a board-certified gastroenterologist to have your colonoscopy done. Of course, I'd love you to come see me, but if you choose anyone, make sure that they're a board-certified gastroenterologist to have your colon cancer screening done. And you also want to have a careful discussion, with your doctor about your risk factors. If you have significant heart disease or lung disease, if you're on blood thinning medications because you've had a blood clot or some other heart condition that requires that, those are things that need to be worked around because they can increase the risk of having a colonoscopy. But under most circumstances, we can still get it done. As far as the bowel prep, and for many years, I would tell people, "Oh, it's no big deal," and patients would say, "Well, how was it when you took it?" And I hadn't had a colonoscopy yet until earlier this year. So now, from personal experience, I can say, yes, it's not that bad. It's kind of mind over matter. If you're busy during the day and you forget to eat because you've been working, it doesn't phase you. But when someone tells you, you can't really eat, or you can only drink clear liquids the day before the procedure, of course, psychologically that works you up and makes you kind of miserable. But it's very doable. The prep's not bad. And the procedure itself, you sleep through it. The anesthesia we use now is quite different than we used even 10 years ago. It's extremely safe. It's extremely effective. And it's very rare that anybody has any significant discomfort during or after the procedure.
It's just a little bit of discomfort for a lifetime of being colon cancer free.
Absolutely. If you think that taking a bowel prep is bad, imagine what you're going to have to go through if you develop colon cancer. It's 1,000 times worse. Surgery and the whole 9 yards, chemotherapy. I would drink a bowel prep every day to prevent that, honestly.
Definitely. Well, I know we have a couple of questions in the chat. Or I know for sure we have one. So I have one question coming in: is how long does it take for a polyp to develop into cancer? So let's say, you don't catch it in time.
Yeah, cancers grow typically very slowly from a polyp, and the traditional teaching is that it takes about 10 years from the beginning of a polyp to turn all the way into a cancer. Of course, some may be more aggressive than others, but in general, it takes about 10 years. And that's where the recommendation to have a screening test beginning at a certain point, i.e. now at 45, but then if your colon's completely normal, you have no polyps, we're going to ask you to come back in 10 years to get another exam. So again, to answer the question, it's about 10 years.
All right. Well, I am not seeing another question come in right now. So, yeah, I guess that's it. Well, I thank you so much, Dr. Marrero, for coming in and having some time with us on Facebook and taking some time to answer our questions. It's a really good time to talk about this, kicking our rear into gear to getting those colonoscopies and keeping that top of mind, even if it's, I know, like, I am not the age for a regular screening, but I have parents and loved ones who are. And so that's important to know, even if it's just for the people that we love, to remind them to get their colonoscopies to stay up to date on those. So,
sure. And that's important. Get the word out, make sure your friends, family, loved ones get screened if they're of age. If they have hesitation to do it, twist their arm, get them to go. And again, I stand by the fact that I think that a colonoscopy is absolutely the best screening method under most circumstances. But if there's any, trepidation to having a colonoscopy or where you would go for screening, at the end of the day, the most important message is get screened somehow, somewhere. Talk to your primary care doctor about it. Talk to your gastroenterologist if you have one. We'll help you go through the options and pick what's best for you. But the bottom line is, no matter what you do, find some way to get screened. Colon cancer is completely preventable under most circumstances, and it's really a shame when somebody shows up and we find it and we know we could have prevented it had we done something years earlier.
Awesome. Well, I'm going to go ahead and put some information up on the screen. This is how you can get in contact with Dr. Marrero's office and call his office and make an appointment. Just to recap, what are some of the things other than screenings and that you could help treat?
So basically any kind of intestinal symptom, nausea, vomiting, abdominal pain, heartburn, diarrhea, constipation, inflammatory bowel disease, liver inflammation, hepatitis, pancreas inflammation, basically anything that has anything to do with the gut, we're happy to see it. And if it's something that we feel would be better managed in some other way, we can help you get the best care that you need. But you got to start somewhere. If there's any concern that you have any problem anywhere in your intestinal system, including the pancreas and liver, gallbladder, come see us and we'll help you out.
Awesome. Well, thank you so much. And everyone who's watching, just know that we do these live and on-call episodes every once in a while, talk to different specialists about different topics that may be important to you and your family. And so join us next time. We will surely be back. Thank you, Dr. Marrero.
Thanks, Allison.